The people who influenced me to become a doctor were my parents. They were both in the medical field, and they would come home and tell stories about the different types of patients that they would work with and just how satisfied that they were with their jobs. So I kind of got started that way. I remember the first surgery I ever got to observe was I was actually observing my dad, who was a CRNA, and it was a cesarean section. And I was hooked. I wanted to be a surgeon from that moment on, and I was in high school. So I immediately just pursued that career. I was on that track from the beginning, and here I am now. I played college athletics, and I did have an injury to my foot and ankle, so I saw a podiatrist and thought, well, that's interesting, you could specialize right away. So sports medicine kind of got me hooked into the field. There's such a huge need for caring for patients who are diabetic, and that's also been a passion of mine. I pursued some clinical research during my residency training to try and prevent foot ulcers, try to prevent amputations, and so that's kind of been a big passion of mine. One of my favorite things about what I do is educating patients on the different kinds of options that they have to treat their foot and ankle pain. Oftentimes they have no idea. They've been dealing with this pain for years. So giving them that little bit of hope that they can maybe return to an activity that they had lost because of the pain really just gives me a lot of satisfaction. Well, growing up in Wisconsin, we love the outdoors, and that includes hunting, hiking, fishing. So my husband and I are pretty avid outdoorsmen and women, and we like to spend our weekends out on the lake or hiking a favorite trail or just exploring the woods nearby. There's so many places to go in Wisconsin. It's just beautiful.